This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. I'm going to discuss at-home psychedelic ketamine therapy with ketamine dots and oral ketamine. So what exactly are ketamine psychedelic dots? Well, ketamine dots really kind of refer to a combination of ketamine, midazolam, and ondansetron. And this is a combination of just a low-dose ketamine troche that also has a little bit of a sedative in it, Versed or midazolam, which is a kind of a rapid-acting benzodiazepine, and Zofran, which is an antiemetic. And these can be flavored for a number of different flavors. They are excellent for periodic use for insomnia, anxiety relief, pre-procedures, and panic attacks because they are rapid-acting and they don't really put you down for a long period of time. But on the other hand, though, for periodic use, especially when it comes to anxiety and panic attacks, especially in the evening time, when the use of just straight ketamine can actually be activating and keep you up at night, something like this, where you have the midazolam added to ketamine, actually allows you to basically kind of get to a restful state. And basically, the use of this is you place the tablet under the tongue or between the cheek and gum for about 10 minutes. And you hold it there. And most of it gets absorbed under the tongue and the venous plexus there. But you can also put it, again, between the cheek and gum. You could then swallow the remaining mixture. And it does provide kind of a second peak of effect for the individual. And it provides kind of a rapid ataraxia, just kind of a calm relief. And like I mentioned, it's also a lot less activating than just straight ketamine. So it can be used in the bedtime for kind of relaxing purposes, and it won't keep you up all night. Now, of course, this is something you would use periodically because obviously with Versed, over time that would eventually cause some amount of tolerance. Now, the other options for home-based therapies are ready-to-dissolve tablets, RDTs, and these are seen up here in the center portion, and they're basically compounded kind of explosive tablets that you can put at a number of different doses, anywhere from 100 milligrams, 200 milligrams, 300 milligrams per tablet, and they're kind of chalky in nature. Of course, ketamine does have kind of a awful flavor in general, and this is no different. Certainly flavoring can be added. Now you place this one under your tongue or between your cheek and gum, and it's kind of a chalky effect. The tablet tends to kind of just explode and open up. Hold it there for about 10 minutes. There's two options for the follow-up is either to swallow the remaining solution after 10 minutes or spit it out. And if you swallow it, basically you'll get kind of a second event or a second peak later on. But if you spit it out, you'll less likely get as much nausea or cramps, which can occur with swallowing the ketamine itself. You get about 20% absorption of the total dosing, and this is utilized anywhere from twice to 3 times per week for depression, mood disorders, suicidal ideations, sometimes even for pain management. And the starting dose is variable, so if the individual has been getting ketamine infusions, and generally at Nova Health we'll transition individuals to, for example, maybe 100 milligrams 3 times a week. And the effect of this seems to be very rapid and certainly very powerful for a lot of individuals. Of course, you don't want to drive for about 4 to 6 hours after, and use this at home in a relaxing environment. You play your ambient music and kind of do your mindful meditation. Certainly you want to be in a safe zone. You don't want to be in a bathtub or anywhere unsafe when you utilize this. And also the other fact is that you don't want to be looking for a signal. You don't need a journey when you use home-based ketamine. Effectively, you're looking for neuroplasticity, and you're looking for the long-term effects, which is, again, neuroplasticity. And the way that we escalate the dosing is based on clinical effect, which is, are you basically less depressed? Are you feeling overall better in terms of your mood and less irritability? And you can escalate the dosing week by week over a long period of time. You don't really change the dosing based on whether the individual is getting a journey or not. Effectively, the journey is not necessarily related to long-term effects. Then there's also the option for ketamine troches, which are waxy hard candies, if you want to call them that. And the doses are variable. Again, these are compounded, so you can make them pretty much any dose that you want. And we'll make them anywhere from 30 milligrams per troche up to several hundred milligrams per troche. And there are some centers that use really high doses for these in the several hundred milligram range. That said, only 20% of each troche gets absorbed, and it's also utilized by placing the troche between the cheek and gum or under the tongue and holding it there for about 10 minutes. You'll generally feel effects within several minutes, and it peaks at about 20 to 30 minutes. We recommend no driving for 4 to 6 hours after use. And the main side effect, like the other formulations, is nausea and dizziness, mainly vertigo, just due to nystagmus of the eyes. Certainly, there can be brief blood pressure changes that resolve rapidly and don't generally need any type of treatment. We titrate the doses for this one to clinical outcome, and it could take several weeks to see the effectiveness of home-based ketamine, oral ketamine. You may take 3 or 4 weeks before you start to really get significant relief, although sometimes you start to see the relief relatively quickly when you start this treatment, but the maximal effects can be several weeks, especially when it comes to suicidal ideation and severe depression. Now, for some individuals, they'll use kind of a regular daily low doses in the morning, like a 30 milligram troche, and they'll do this several days a week, if not every day of the week, just to kind of get the day going. And they'll kind of do their meditation and relaxation, and then several hours later kind of head out on their day, because ketamine can certainly be activating and can have a tendency to increase focus and attention for a lot of individuals. Once again, there's no journey required to see effectiveness. This is really about how the person is doing clinically several days and several weeks later. And that's based on traditional scoring measures such as PHQ-9s and MADRS scores, etc. The taste of this type of ketamine troche, really, it just varies by how they flavor it. And of course, even with flavoring, it tastes like ketamine, which it tastes pretty much bad. Now, what about ketamine infusion therapy? Ketamine infusion psychedelic therapy. Well, ketamine infusions are definitely the most effective way to treat an individual. They are safe, they are rapid, and certainly you'll receive remission and response more rapidly in ketamine infusions than any other method. Up to 70% of patients who receive ketamine infusions can see some effect, whether it's remission or response. And definitely infusions are threefold more effective than S-ketamine, and probably home-based therapies as well, just based on transitivity. A series of 6 to 8 infusions at 2 to 3 times per week at 40 to 45 minutes each, with escalating doses between 0.5 milligrams to 1 milligram per kilogram is generally the routine. So we start at the lower dose, and it's based on ideal body weight, and escalate per visit up until side effects kind of interfere with the patient's treatment. And the main side effect is nausea and dizziness, mainly vertigo, that is transient and goes away within a short period of time. But after the infusion, no driving for 4 hours. We do medicate at Nova Health prior to the infusion to prevent nausea. Pretty much a number of different medications can be helpful, anything from scopolamine to meclizine, and of course, classic Zofran and Compazine, even Reglan in the bag. There are some centers that use Decadron in the bag, and we've even seen Benadryl used in IV formulations of IV ketamine therapies. Generally, the effects are seen for depression by about the third infusion, and ketamine infusions are the most effective way to receive and achieve remission from depression and mood disorders. And at Nova Health will then, after the series, transition the patient to at-home maintenance ketamine therapy with either ketamine dots mixed with oral ketamine and home-based intranasal ketamine. You're generally awake with each ketamine infusion session, and each session gets progressively stronger up to a certain point. But just remember, you don't need to lose control during the infusion to have effect. There is no association with dissociation. Now, some people do feel that you have to dissociate to get the maximal effect, but again, there's a number of meta-analysis that demonstrate that you do not have to dissociate, and that's kind of what we see as well. And if you're getting an infusion, it's certainly a lot more controllable than doing just general deep home therapies. And if a person, while they're getting infusions, gets anxious or any side effect, we can just slow the infusion down. We can even stop the infusion or add medications to help the individual out. And you're able to work the next day after your infusion. I mean, these are very efficacious and there's very little hangover, so you're very effective the next day. So this won't interfere with your ability to function the following day. You have to remember, this is a treatment, not a cure. So it does not treat behavioral or habit problems. In other words, you basically have to do the work in changing your behaviors and habits. There's no way to medicate away behaviors. We can also use intravenous infusions to treat substance use disorders as well, and we would use this in conjunction with standard treatments. And one other thing is we mentioned that ketamine therapies for mood disorders are basically treatments, not cures. So you need to use booster infusions frequently at monthly intervals. Of course, we utilize home-based nasal spray and oral-based ketamine therapies for maintenance at Nova Health Recovery. Frequently, they're quite effective at maintaining the individual in remission or significant response. In the meantime, the individual can maintain their traditional antidepressants frequently, which we keep the same during these infusion processes. Now, this is an example of a ketamine vial, and generally it's about 50 milligrams per ml, and we mix it in with IV saline, and individuals will sit in a room such as this one seen on the left during their infusion experience, usually with galaxy lamp lighting and ambient music, or the individual brings their own music. Generally, we prefer them to bring in ambient style music. It is generally a relaxing and calm experience. And these are just examples of other forms of ketamine, everything from ketamine dots to ketamine troches, RDTs, and even ketamine nasal spray, which we've discussed in other videos.